Hello there, and welcome to our broadcast today. I'm your host, Lori Kelly. I'm the Chief Philanthropy Officer here at Providence. And as a reminder, before we get started, wanted to let you know that the information provided during this event is for information purposes only. And for any medical questions, please reach out to your primary care or healthcare provider. So today, joining us, I'm really excited. I've got two friends on the line here today, and I'm looking forward to talking to you guys. It's Giving Tuesday, as we all know, and we have Steve Moore, who is the CEO of the Murdock Trust, and then Dr. Dan Osrin, who is the Executive Medical Director of the Providence Heart Institute, with us here today, and we're going to talk about philanthropy and why it's so important in our communities and to our organizations, and just in everybody is able to be a philanthropist depending on your level of giving, but everyone can get involved in this. And I think a lot of times people don't realize that it's for everybody. It's not just for the rich and famous. So to get started, if you could just tell a little bit about yourself and the trust, it would be great.
So I have been at the Murdock Trust now for about 15 years. The trust was founded from the estate of Jack Murdock, who was a longtime entrepreneur, co-founder of Tektronix, and died unexpectedly. I mean, an accident on the Columbia River in 1971. He was chose to have his entire estate go to create a trust that would be dedicated to nurture and enrich the educational and cultural, social and spiritual life of individuals, families, and communities. And so that's really what we've been doing for 45 years, is to try to partner with organizations, basically in science, education, arts and culture, and health and human services, and to build and help support the ecosystem of organizations that work in those areas in the Pacific Northwest.
Yes, and over the time you've given over $1 billion away, isn't that correct?
Yes, it is.
Amazing.
The assets have grown from about 100 million to about 1.5 billion, and we've been able to also distribute through programs and grants over $1 billion in the region.
Amazing. Yeah. And in Providence, throughout the West Coast and ISB too, our Institute for Systems Biology have been recipients of that generosity. So we really appreciate that, Steve. And Dan came to Providence many years ago as an electrophysiologist. And then tell us about your career and where you're landed up here now.
Sure. Thanks for asking me to participate, Lori. So I'm a native Portlander, native Oregonian, grew up here, did my education all over the country, and in the early 90s was lured back to St. Vincent's Hospital to start an arrhythmia program. Arrhythmias being abnormal heartbeats, and spent really most of the next couple of decades growing that program to one of the bigger programs in the Northwest. And about 10 years ago, started assuming more leadership responsibilities in developing a strategic plan and growth plan for our Heart Institute, and really stopped actively practicing as a cardiologist 7 or 8 years ago, and have been really focusing my time on building the Heart Institute, executing on our strategic plan, and really fully realizing and understanding the importance of philanthropy in what the Heart Institute's been able to accomplish. So it was a real gift to be able to have kind of two parts to my career, this being the second part.
Yeah, and I always tell Dan, he's probably the best fundraiser we have. He's done such an amazing job in a short amount of time, really raising a lot of money and awareness for the Heart Institute. And with that, the programs and services that we've been able to provide for people has been just grown exponentially. And we'll talk a little bit more about that throughout this conversation. But Steve, kind of, Murdock gets approached by how many hundreds, thousands of organizations. How do you decide what organizations you want to invest in, and what's the process like?
Yeah, that's a great question. And we have tons of information on our website about this. But in short, we focus on the areas that I mentioned earlier, and we really see our work as capacity building, helping build the capacity of organizations so they can fulfill their mission. The great thing about philanthropy is there's a broad range of kinds of foundations, and foundations do lots of different things in lots of different ways. We often say you've seen one foundation, you've seen one foundation, because they're all so different. But our focus is really on capacity building. And so we really try to identify ways that either through building technology capacity or research capacity, for example, in relation to Providence, or capacity in terms of a facility, those are the ways that we best kind of partner with organizations, knowing that we're not the only one that is going to be the partner. That's going to be really a whole group of people and individuals and organizations that are going to help an organization fulfill its mission.
Yeah, yeah, and I know a lot of times Murdock too likes to be that top off too, right? You've seen a project come to success. There's a lot of other investors, and then you're kind of like, okay, I think you're going to be able to take this to the finish line, so we're going to help you get there. But yeah, so you just, it's incredible the process too. I think that you guys go through the learnings and everything that you have for all these organizations, and so we feel like you're true partners with us. So really appreciate that. And Dan, talk about recently we've had this great new project here at Providence Heart Institute with the heart transplant. Could you talk a little bit about that and maybe cards and how philanthropy has really played a role in those two programs?
Sure. It's really been essential and a differentiator for us, I think, our ability to, for the community to support us through philanthropy. So as you know, a couple years ago, there was a disruption in the transplant community in Oregon. Heart transplants weren't available. And we had a fair amount of infrastructure and some capacity, to use Steve's term, to kind of move into that space. And with the philanthropic support of Phil and Penny Knight, actually, they were the people who really pushed us over the finish line in this decision. We said, well, we're going to plant our flag in the ground, and we're going to start a heart transplant program, which we did last summer, and have slowly been building our program quite successfully. We've done 5 transplants now and have more on deck. But again, it was an example of, we had a vision. We felt it was important to the community, and we had donors that were responsive to that need. In other areas, philanthropy has really provided, I guess I would almost call it seed money, allowed us to be sort of incubate an idea that we thought had promise, to then bring it to life and then get investment from the health system as we prove the concept of what we want to do. We've done that in a lot of our prevention and wellness programs. You mentioned cards. That's another big area for us. It's the Center for Cardiovascular Analytics and Research Data Science. It's run by an incredible physician named Ty Gluckman, who really is leveraging big data, the big data that we have both in Oregon and throughout the Providence system, to develop better knowledge about how we care for patients and what are the gaps and disparities in care that we all know are out there, and especially have seen during this time of COVID. So again, philanthropy has been a big part of that.
Yeah, and I think it's a lot of people don't realize that we can't do this with just patient revenue. Where people think about healthcare as big business, that kind of thing, but our margins are actually quite slim. And without the investment of philanthropy, there's just no way we can do all these new programs and also care for the poor and vulnerable the way that we do. And that is really one of Providence's core values, that we will not turn anybody away. And so philanthropy really helps with that. But yeah, the seed money, and then just the other thing, Dan, too, that you talk about is just the ability to recruit the best and brightest. Right? So talk a little bit about that.
It makes a huge difference. I mean, we've been able to, I think, kind of combine innovation and compassion in an interesting way within the Heart Institute, and kind of keeping those two ideas as our North Star. We've been able to develop new programs, and you're right, we couldn't do it from healthcare margins alone. And philanthropy, again, allows us to initiate some of these new programs and prove that they can work and develop a return. And as a result of that, we've actually become a real destination place for cardiology recruits from all over the country. I mean, we really do get our pick of people when we have job openings. And again, it's because we have research opportunities, we have a transplant program, and we have everything that a Stanford or a Mass General has. And so we can recruit them to Portland, Oregon, which is a fabulous place to recruit to these days. So that is, I won't say an unintended, but it's sort of an indirect consequence of philanthropy. But we do talk to our donors about it, because building these programs creates a better institute, which creates an attractive place for our physicians to come.
Yeah, that's great. And Steve, I always wonder, when you're funding all these projects, and then, people like us go back to you and say, hey, here's what we're doing. We want to make sure that you're apprised of this. What happens when a project goes bust?
It's a great question. And it's not common, but it does happen. And part of what we also recognize is there's learning capital that comes out of failures. I mean, that's really the story of science research, is figuring out in part what doesn't work.
Right.
And that's what they've been doing, trying to discover a vaccine for the virus. And so it's a combination of those kinds of things. And so I think it's just recognizing there's some learning capital that goes on as well in any kind of organization or any kind of ecosystem. And I think the other thing is just it's really important to recognize is that philanthropy is really about generosity. And generosity is something that is available and possible and should be a part of all of our lives, individually, families, in all sorts of ways. And it's not just being generous with money, it's being generous in other ways as well.
It's true.
Yes, absolutely. Dan's actually married to a woman that has her own philanthropy too, and it's Urban Gleaners, so feeding people, hungry people. And I always got to put a plug in for Tracy. There's just so many great people doing good work, and I think Tracy is one of those too that has a lot of volunteer opportunities as well. And so always looking for how you can get involved and finding something that's your passion, and then taking it further. And so for us in healthcare, so many times we have grateful patients or grateful family members, even after someone's maybe even been lost. We haven't been able to save their life, but people that just feel so indebted and really want to get involved with us. And here at Providence, we have 44 foundations throughout the West Coast. So if you live on the West Coast, there is probably a hospital and a Providence Foundation near you. So, if you want to give locally, we really encourage that. There are also opportunities to give at the system too, and to big programs like the Heart Institute, the Cancer Institute, all of our research. So, but I think the one thing I think people don't realize is that there is something for everyone. And so find that passion that you have and really learn more about that organization and just get more involved. And so what are ways that that people can find out more about what opportunities are out there? Do you have any ideas for those that are maybe watching right now? I think patients, sometimes I think, how can they get involved? How do they know what we're up to? Steve, some of all the organizations that you work with, who's really successful in finding those people that really want to get involved with that organization?
Yeah, I think that one of the things we'll see in the next decade is a new rise in volunteerism. I think people are really wanting to give of their time and energy and expertise in meaningful ways. And the organizations that provide opportunities to do that will be the ones that will attract people to really invest their time. So I think that's going to be a very important thing. We have some great nonprofits in Oregon and in the Pacific Northwest. And, the thing I think sometimes we fail to recognize is how things fit together. I think, for example, of arts and culture organizations that have suffered during the COVID times, that are not only important as business economic engines in our community, they serve in that way. They inspire creativity, and it's really a mental health kind of thing. And so I think recognizing how arts and culture fits together with education, that fits together with science, that fits together with health. And I mean, the work of urban gleaners is a great example of people that have said, we're going to make a difference in small, seemingly insignificant ways. Things add up to make a significant difference. And I think that's a great example of that Tracy's done there.
Yeah. I think one thing is that people often feel that they're one person, they can't make a big difference. And I think that's one of the messages that we want to get out, is that everyone's gift makes a difference. And so people can give to their ability. And I think we have a slide here that talks about the origins of the Providence Sisters, and how fundraising actually got started at Providence. And I don't know if she's going to be able to share that, but here are the sisters on horseback, and they would go on these things that they were called begging tours, where they would actually go out, and through their begging, they would go up to ordinary citizens. Also, many of them were really struggling. And so there are funny stories about the sisters really not taking no for an answer and trying to let people know about why it was so important that they would give back. And so I think, today we've got a lot more sophisticated. There's online giving. There's a lot of ways to give that don't employ riding on a horse or meeting somebody face to face. But I think, it's always been a part of the charism of the Sisters of Providence and the Sisters of St. Joseph. And it really has brought us to where we are today. And they started not just with healthcare, but also with education. And that's something, too, that I think Providence is doing right now, too. We're trying to make sure that our healthcare providers are the best educated, that they've got opportunities to grow in their roles as well. And that's even some of the opportunities that we have in fundraising at Providence. So I just love that picture. And I had one with that didn't come over, but it was actually some women on the sisters. They were in Alaska, and they were dog sleds were pulling them. I thought, these women were tough. I'm telling you, COVID had nothing on them. I would have loved to see what they've done. And right now with fundraising, it's hard to meet people face to face. Our board members and everything are all online, Zooming, and so there's a rise in COVID right now. And Dan, we were just talking before we got online about what's going on in the hospitals, and wondered if you would have anything to share with us about what's going on, how it's impacting heart patients, and kind of your prediction for the next month or so.
Yeah, no, I'd be happy to. I just want to take a moment to expand on something Steve said about sort of what philanthropy is. And it's giving in all sorts of different ways. And obviously, dollar fundraising has been important to the Heart Institute, but volunteer work. And we have in normal non-COVID times, we have tremendous opportunities for people to help with our heart programs. I absolutely concur with Steve's comments about the rise in volunteerism over the next number of years. I think he's right, and I think people get great personal sustenance from that kind of work, and so we look for that as well, and want to do everything we can to provide opportunities. COVID, it's going to be a tough month or two. I think we've all listened to Dr. Fauci and others. We are seeing a surge in at least the Portland metro area at our hospitals. It's taking, I think a mental toll on our caregivers. Fortunately, we've not been yet hit as hard as some regions of the country, but we are having to, redeploy frontline caregivers to take care of these patients. I think the good news is that over the last number of months, our doctors have learned more about how to manage someone with COVID, and as a result, the mortality of patients hospitalized is less than what it was. But if the number of patients, if the denominator goes way high, we're still going to see some real tragedy, unfortunately. And, I think Providence has done an incredible job of organizing their workforce. We are hopeful that the vaccines get to us soon. We hope, sometime this month we'll be in a position to be able to deliver those vaccines to our frontline workers. In the meantime, we just continue to take it a day at a time. I mean, Providence's the Cancer Center group has been at the forefront of some vaccine research and viral research that I think will pay dividends down the road. We learn more and more about this disease every day. We know that it has effects on the heart, significant effects on the heart, causes inflammation in all different parts of the body, including the heart. So we know that happens. What the longer term sequelae or outcomes will be on heart function in someone who's had COVID, we don't know. It will be studied very closely. I mean, to be perfectly frank, we're going to know more about this virus than we know about the flu virus, because there's so many more people who have gotten it, and we're studying it so much more closely. It may be that other viruses have had similar effects, but we haven't really looked as closely at those viruses as we are looking at COVID. So it will be an area of long-term study for years to come.
Yes, and actually the trust called us early on when everybody was, we were just learning about this for the very first time, and PPE was a big problem, and there were all kinds of people, just kind of running around trying to figure out how we were going to just get through the first few weeks of it, and provided us with some funding that we've been using for research and development and study in various areas, and care for our caregivers, testing our heroes, we called it a campaign. So we wanted to make sure that people were getting the proper testing when testing wasn't as available. So, you guys really led the way early on. I mean, really, I think that first week we heard from Moses, who was saying, we want to find out what you guys are up to. And again, we are working on a vaccine at the Cancer Institute too. There are many vaccines under consideration right now. I know we're hearing more about some of them that are in the news. But Dan, how will they find out which vaccines are the most efficient and effective, or do you think there will be 7 of them that people are getting?
Yeah, I mean, I think that the vaccinating the world is going to take more than one company to do that. I mean, we're talking, I don't know, billions of people. And so I have confidence in the FDA and in some of these regional review panels. I suspect that we're going to see the emergency use authorization approval in the next number of days, and then the distribution of those vaccines to the states, and then from the states to a prioritized list of recipients based on CDC recommendations. And so despite all of the noise sometimes you hear, I do have great confidence in the FDA and the CDC to make the right recommendations. And frankly, I guess in our military to deliver the vaccines to where they're needed. So which is not to say it's not going to be, an enormous lift. I think that, making sure that there's acceptance of the vaccine in the community, getting it to vulnerable populations, getting it to, disadvantaged populations who may not have the same access to healthcare facilities. I mean, again, COVID has exposed some of the glaring disparities in healthcare that exist in this country. And while we need to address them on an urgent basis, I think one of the things we talk about is, what are the systems of care that we can change so the next time something bad happens, there aren't the same level of disparities that are evidenced. How do we change the systems that lead to this? And that's actually one of the kind of leading objectives of our CARDS research group right now, is how do we look at public policy initiatives that will address disparities and change systems of care?
Yeah. And Steve, how has the pandemic kind of made you guys look at what kind of things you're funding, and what would you say to the individual donor too that is looking at what are the types of things that I want to fund right now that I might have looked at differently a year ago? And I think, of course I'm biased, but healthcare to me has got to be tops on the list because our health is everything, as we've seen here. And there's so many worthy organizations right now, but there's also so many organizations in need. So how has had that changed your thinking and planning?
Yeah, really, I would say I would kind of echo Daniel on this because what our trustee said to us back in early March was, let's think of how we might lean into the partners that we've worked with in these various sectors that we've worked with, and how might we be able to help them as they serve the most vulnerable among us? And so, when you look at healthcare, or when you look at food banks or shelter or whatever it may be, I think that's one of the things that we've really sought to do in our COVID response support is to say, how can we support those who are most vulnerable among us? And so I think there's been some pretty, as Daniel has said, some significant needs that we've had to address, and we still will have going forward. I think one of the things that we just did a round of grant support to groups that have been impacted by the fires, and
Oh, yeah.
the response on something can sometimes be uh, very significant and important, but it's that follow-on support and the later support that becomes equally important in sustaining an effort and really making sure that you complete some of the things that need to be done.
The fires, which is really an interesting thing. We've been doing even just some internal fundraising for caregiver support for those who have been impacted by the fires. And we talked about this as sort of a one-time thing. And now we're saying we need to have this plan for every year, because moving forward, this is probably not going to be, once in every decade type of problem. It's going to be happening a lot more frequently. So those kinds of things, and there's a lot of need around it, and we want to make sure that our caregivers are well provided for. We have something called a caregiver assistance fund where people can go a one-time support that might need some additional assistance and get some funds there. So if anyone is interested in supporting our caregivers or any of our other efforts, we are live on providence.org, and then you just click the donate button, and there are several programs that you can invest in if that's something that you want to do this year at the end of the year. And there's also a lot of opportunities this year too with the CARES Act. So talk to your accountant, but there's a lot more deductibility for various gifts that you can make this year, 100% of your adjusted gross income for a lot of people. So the government has made it a little bit more incentive for people to give. Even people that don't itemize their taxes are able to get a $300 deduction or $600 for couples. So something to think about at the year end. I think a lot of people are thinking about maybe a gift that they might want to make here at the end of the year. So I want to just thank you guys so much. They're rolling a scroll right now, but to learn more about the Murdock Trust, it's on the bottom of your screen there, Providence Heart Institute, murdocktrust.org. The Providence Heart Institute is also on our website at providenceheartinstitute.org. And I want to thank Steve and Dan for being here today, and thank everybody that gives in any way.
Thank you, Laurie, for letting me do this. And thanks for all you do, Laurie. You're a champion in the community. And I just want to give a huge shout out to Laurie Kelly. She's one of the heroes of our community. And Daniel, thank you for what you do. This morning on an earlier Zoom call, I asked people, how many people on this call have been touched by someone who's had to have heart surgery or care in that kind of way? Significant. Nearly everyone on the call. And I said, how many have been touched by Providence? And it was amazing how many have been touched by Providence. So thank you, Daniel, for all that you do and the leadership that you provide for the group working on that. We're really fortunate to have you all in this area.
Thanks, Steve. And thank you, Laurie, for everything you do. It's good seeing you all.
Oh,
good to see you.
It's really good to see you. Yes. And thank you guys for tuning in today. Really appreciate it. To learn more about our initiatives, programs, and services and ways to give, please visit us online at providence.org. And make sure to follow us on social media at Providence Health System for LinkedIn, Facebook, and Instagram, and under Providence on Twitter. Thanks so much, everybody. Have a great Tuesday. Enjoy December. Here we go, end of the year. Thank you so much. Bye-bye.